much interaction you guys have had today with each other, but you're going to get to even more in some smaller groups. So my name is Kristen Cook, and I am a faculty member here at the UNC College of Pharmacy, and then I'm a pharmacist who practices in an ambulatory care clinic here on the Nebraska Medicine campus. So my kind of area of focus is education and teaching. So in addition, I coordinate all of our skills-based labs for our pharmacy students. So all those pharmacy students that you guys work with if you work in the state or potentially in other states as well, we're teaching the students some of the skills they need to be a pharmacist. And so we're going to do Escape the Pharmacy today. So I have built a couple different escape rooms for our pharmacy students. Given the COVID situation, typically we do these over in our simulation center where I would actually put you in a small room with 4 other people, and we would shut the door and have you in there going through a series of puzzles. And I'll kind of talk about what an escape room is, but given the COVID situation, that is probably not the best idea at the moment. So we have a little virtual escape room I'm going to have you guys work through in groups in here. The theme, I think, of this conference was the Pharmacy Technician Code of Ethics, so I have that up here. These are the objectives for this session. So we're going to talk a little bit about teamwork in the beginning, and then we're going to actually have you do the activity where you're going to have to work as a team, and then we're going to debrief that activity afterwards. We are going to use some clinical skills that you guys have as pharmacy technicians. So some of the problems you'll have to solve within the escape room are going to rely on some of your skills that you hopefully already have. And you'll kind of have to figure out together who has the skill, who's best to figure it out. You'll kind of have to figure out how to work through the problems as a small team. And then part of the scenarios will be interpreting data and prescriptions and things like that as we're going through the escape room. So we all know, or I think, teams or groups of people that work together that function well can make a job. It's really a make or break sometimes, the people that you work with and how you work together and whether you can be open and honest and be efficient as a team. So I'm just going to give you a couple of these little sort of tidbits how to work in a team. We actually use these in my clinic. So I work in an interprofessional clinic. So we work with internal med residents, physicians, nurses, pharmacists, med techs, radiology. So we have a whole group of people as well. And we use this every single morning and every single afternoon at the beginning of each of our sort of shifts of patients. So we do a brief to start with, and this is where at the start of your shift or at the start of your day, really you're kind of telling each other what the roles and responsibilities of each person is. So you're responsible for this, you're responsible for this, this is your role today, and then your goals. So whatever your goals are for the day, whether it's just to finish on time, which I think is a goal sometimes in pharmacies is to get out actually on time, that occurs in the brief. So everyone ideally knows where they're going at the beginning of that day and who they're working with. We use huddles. So huddles can occur with the whole team, it can occur with a small portion of the team, it can occur with just one other person. And so this is where you might be working through something, or for us, we may have a difficult patient who's upset with us because we aren't going to prescribe the medication that they feel like they want when they leave our clinic. And so I may huddle with the physician and walk through what's going on. It's where you express concern and empathy for the other people in the situation, and you make adjustments. So if one person is just getting slammed during the day and they need help, there needs to be an adjustment made. But that person also needs to acknowledge that and actually ask for the help. And then we do debriefs sometimes if we remember at the end of the day. So how our day went, what went wrong, is there anything we can change for the next day to fix it? It sounds really simple, but a lot of workplaces don't actually sort of check in and have this communication. And so it seems simple, but maybe observe when you go back to your workplace how much communication and teamwork is going on. So how we're going to kind of work through that today, or have you guys actually see how teamwork works on the fly with people that you don't really know, is through gamification. And so this is one of the things from my perspective, from an education perspective, that I've developed a lot. So we do a lot of teaching of skills with gamification, which tends to engage students in the tasks or what we're trying to teach them, or really any learner. So if you have teaching or training as part of your position as a technician, which I suspect a lot of you do, if you have the latitude, there's a lot of actually data and studies on gamification and making tasks or learning things into a game as an effective way to actually get people to learn and retain. And there's a lot of different ways to do this. We're going to do the virtual escape room today, but you can use points, badges. Some of your workplaces may have this already, where there's a point system for doing certain things. Leaderboards, we do a lot of game shows. We do Jeopardy, Family Feud, Scavenger Hunts, Amazing Race in our skills-based lab. And it's really gamifying the process, not the content. So if you're trying to teach another technician how to do something, it's really the process that you're gamifying. It's not the actual knowledge that you're teaching. How many of you guys have done an escape room before?
I've wanted to.
Wanted to? Okay. I think a lot of them were shut down probably over the last year. Maybe some have opened up. But I included a link if you want to see a short video as to what it is. I don't think I'm going to play it today because I want you guys to actually get in your teams and actually work through the problems. But really it is where we put people, or people are in a confined space or a room. Like I mentioned, we use our simulation rooms when we're able to do this in person with groups of people in a confined space. And we have different puzzles and things that our students or our learners have to work through. And so we may have things hidden in the room, we have locks in the room. You guys are ultimately going to, whoever finishes first, unlock this today. So this is our small version of an escape room. But we have lots of those locks and types of things when we do it. And if you've done an escape room, you know that that's the case, where there's codes, you have to look for what you need. You really have to work together as a team. It's time limited. I have never run this virtual escape room that you guys are doing today, so I'm guessing on the time, but usually an escape room is 60 minutes. We're not going to do 60 minutes, 20 minutes tops. I think you guys will get through it faster than that, but having done it before, I don't know. Usually there's a theme, so the theme today is going to be Escape the Pharmacy, and you'll see that as you go through the escape room. Really, they originated as a video game concept. So it was video gaming that sort of, in these virtual environments with escape rooms, translated to the physical spaces, and really became popular in the early 2010s. So not a lot of you, or not everyone, has done one, but I think the way the virtual one's set up, you're going to catch on very quickly. Okay, so now we're going to actually have you guys go through it. And so the best way to do this, have you guys used QR codes before? Is this screen?
I did.
Yep.
Did everyone in your group get that pulled up?
Hit next, sorry.
Okay, everyone, at least one person in each group have that?
Okay.
Okay, so we're gonna go. I technically have 15 minutes on the timer. We'll see. It is sort of a race. First group out is gonna open this first and see what's inside. And so you guys can work as a team and start working through it. And you can ask for one hint. So if for some reason you can't figure something out, one hint.
That doesn't have to be all caps too, does it?
Just has to be a number.
Oh, a number, okay.
It's 2.
Okay.
How many vials of Lantus should you dispense for a 30-day supply?
Do they have actual?
And how many units?
Yeah, how much they're,
Dose units 68 twice a day.
where do you guys all work at? Okay, cool.
I work for both bakeries and
Yes.
Oh,
I just don't
okay,
wanna
fine.
shake it, I just want it to sit there just like that.
It looks like a lava lamp.
Yes.
Like some old years and found out most insurance didn't cover it, so it just wasn't
Fascinating.
cost effective. As long as I don't have to get helpful to
Alright,
patients.
it's not bad.
That's the timer. If you're still working, you can feel free to work. I brought candy for everyone. So if you guys want candy, please come up and grab it. Even if you didn't unlock the box first, you are welcome to all this candy because I don't want to take it home.
I'm sure your kids would appreciate it.
They would appreciate it. You are correct.
I probably would chocolate.
Yeah. Okay, so we'll do just a little debrief of the teamwork and the escape room. So I've seen many interesting things happen, particularly when we are over putting students in a simulation room or pharmacists or pharmacy technicians, whoever we're running escape rooms with. So kind of thinking about how your team works together, how would you rate your team on a scale of 1 to 5 in terms of how you worked together? Okay.
10.
Okay. Any other groups want to share? A 5? Are you saying a 5?
Yeah.
Okay.
I think it went well.
Okay.
it worked well.
All right. A plus team. Anyone else want to share? So yeah, we had a get. Did you say 1?
10.
Oh, it is a 10.
It's a
I think it's
10.
1. Okay.
We won, we're 10.
I guess A plus team. Yeah, whenever you are working in a group, sometimes it's good to have an objective measure of how you worked well in a day. So you can say, oh yeah, we did great, or that was great. And that's all well and good, but if your team working together repeatedly, actually reading how you work together as a team on an objective scale can be helpful for feedback. And we do this with our student teams that are together all year, trying to work through things. And so you actually see them in the beginning rate themselves as a team quite high. And then as the semester progresses, and I feel like they get to know each other and are a little bit more comfortable with each other, they start to drop that rating a little bit. And then hopefully it comes back up at the end. Not always. So what went well in your teams?
They all collaborated together.
Okay. Collaboration.
And everybody had different strengths.
Okay. So what strengths did you guys utilize in your team, would you say?
Really good at math.
Alina was the calculations
Okay.
pro.
Okay. So she did kind of the calculations.
It's like, wait, reread that, we need to,
And Jane was guessing all the different drugs.
Wait a minute, is it that one or this one?
Okay. So she kind of knew the opioids and was just putting them in?
Yep.
Okay. Anyone else? Anyone else?
At least you're still.
I think this wasn't a huge one, probably where there was a lot of conflict, but what didn't go well?
The cake.
The cake? Okay.
No spell check on the app
No.
for the drug names.
Why did the cake question go well? I'm curious.
Oh, no, I was just,
Because
we're
it
just
was
like,
funny
what?
when has the favorite
Why
cake.
does it matter?
See, that question is purposeful in there. So
It
there,
was
any of those answers is correct, but that is something where everyone in the group may so you have to actually come to a consensus on the one thing that you're so that's a purposeful question in
Are we gonna get-
anything you put in was fine, but you had to agree on it. Or if you did it, someone felt like maybe they were left out. Anything else that didn't go well?
Having it be on all caps.
Okay, also purposeful. So we, sometimes we'll put things like that in, to make sure learners are, reading directions, paying attention. So, it also, a lot of learners that we have in this rule, students start previously typing in answers to the question or trying to guess the number on the calculation or whatever it is. And so then they will, as they're doing that, get quite frustrated when it's not working. And so then hopefully their team members kind of pull them back and look at the question and say, hey, did you see that it was supposed to be all caps? So that's actually purposeful in there as well.
I understand how it ties in with pharmacy because you need to look at the details of the order because it's like, is it
Just the basics, you know.
right patient, right drug, right doctor, right SIG, you know?
Absolutely. Yeah, that's exactly what I wanted someone to say. I didn't play at you, I promise. But yeah, that's again, just the attention to detail and the process or the procedure. Anything else that didn't go well?
I think everybody having it on their own phone,
Yeah.
because then you have to like type it in for each person
Yes.
to move on. So that was kind of difficult.
Yeah, agree. Not the ideal setup, and I know you guys have technology issues as well, so whenever we have this, you always have that like question mark whether technology is gonna work. And it's interesting, I see groups do different things when we do this virtually. So some groups will have everybody pull the questions up on their own devices, and then some groups will have one person pull
That's
them
what
up.
we ended
And
up doing.
it's very different the way you work through that. And again, whenever I observe, particularly our students who I have a lot of experience with working in groups, what I tend to observe now, which I feel like has changed, when we give them a case or a problem or something like that, they all pull up their devices, they pull up a Google Doc that's shared, or they put the case in a Google Doc, and then they all have it up and they're all typing on the same Google Doc, sort of working on their own workstation, but sort of collaboratively working together. So just a different way than I was used to, certainly in school, tackling problems, but there's no right or wrong way. Any breakdowns in communication?
I also had another.
Yeah.
We had to adjust one of the numbers because from a billing perspective, the insulin question should technically be 4 bottles, not 5 bottles.
Even
Because
if
it's
the dose is calculated over, it would take more than 4?
Well, it would be, the day supply would be adjusted, because then it would go over
Okay.
that 30 days, and so the insurance will reject it.
Okay,
And so I was just like, 5.
okay. All right, that's good. Good feedback. Thank you. I will change that. Communication. Any breakdowns in communication? Frustrations?
It's that cake, man.
And you guys had finished, but you didn't have the right code.
Right.
To get in, and so, how did you guys work through that?
Just having to reread over it
Okay.
and attention to detail.
Yeah, so we need prompts, and things, so I think people are just trying to, either in a room or when we do it virtually, just getting through, because we do add that like raced element into it, which is also purposeful. We want teams to learn to work together efficiently, and to have just a little bit of pressure on them. Obviously, this is very low stakes. There's no real patients. There's no real drugs or anything like that, but it just adds that little element of pressure when they're working through. I think you guys talked about assigning different roles. Anyone else assign different roles or have like, I won't give examples, but anyone assign different roles? No one assigned like the one person to put the answers in?
We inadvertently did.
Yeah, I ended up with the phone that was going through. She had the paper with, doing calculations, and let's see, what else? She had the handout that had the correct spelling of drug names
Okay.
and stuff.
All right. Good. And some of you guys may do this on your teams anyway. So we assign roles like timekeeper, record keeper. Sometimes just having those specific roles so someone takes responsibility for it makes the team move forward quicker. Did everyone feel like they got to participate?
Yes.
Okay. Good, good. So again, I think, and you guys probably see this in your positions or your jobs, where you work as teams. Ideally, we want everyone to participate, but sometimes, there can be a team member, group member that's left out, either because they don't want to participate or they feel like they can't participate for some reason. Again, I'm sure we observe this many times in student groups, and it's our biggest source of conflict is the perception that a team member is not contributing or is not pulling their weight because they're not participating. I think the thing that gets overlooked often in that situation is no one actually asks that particular team member why they're not participating, or is there something going on in their life, or is there something wrong as to why they're not participating? Do they feel like they can't speak up for some reason? So we always come back. If someone's not participating or not contributing, you should go to that person first and see what's going on. Anyone else have any feedback from the team experience?